Hi, everybody. Thanks for joining us and welcome to today's Safety and Health Magazine webinar, Surviving Safety, Excelling as a Safety Professional While Maintaining Personal Wellness, sponsored by Avetta. We're going to give our audience just a minute or two to settle in today, and we'll be back with you to start the presentation in just a moment or two. Thank you. Hello, everyone, and welcome to today's Safety and Health Magazine webcast, Surviving Safety, Excelling as a Safety Professional While Maintaining Personal Wellness, sponsored by Avetta. My name is Barry Botino, and I'm an associate editor at Safety and Health Magazine. I'll be moderating today's event. We'd like to thank you all for joining us for this webinar today. And before we get started, I have a few housekeeping items to share with you. As a disclaimer, the views of today's speaker and organizations are their own and do not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not mean that the council or the magazine endorses those items. After today's presentation, we'll conduct a question and answer session with our speaker. To ask a question, just click on the Q&A button located at the bottom of your screen. Type in your question and press the send button. You can ask your question at any time during the presentation today. You do not have to wait for the Q&A to begin. We'll try to answer as many questions as possible, but we might not get to every question today. The good news is that any unanswered questions will be forwarded along to today's speaker. After this presentation, you will be asked to complete a brief evaluation survey, but I'll tell you more about that a little bit later. This webcast will be archived so you can access it after today's live event. To view this webcast and all of our past webcasts, visit us online at safetyandhealthmagazine.com/events, or you'll receive a link in our post-event email. With that, let's introduce our presenter. With us today is Cory Worden, who serves as the safety advisor for the City of Houston Health Department. Cory is an experienced safety pro with more than 16 years under his belt, and he's the author of 9 books about safety-related topics. Cory's works have been published by the American Society of Safety Professionals, the Association of Occupational Health Professionals in Healthcare, and the Institute for Safety and Health Management. In addition to receiving numerous military medals and awards, Cory's been honored as part of the 2015 Rising Stars of Safety by the National Safety Council, and he was the 2020 recipient of the Houston Health Department's Excellence in Community Service Award. Again, we thank you all for tuning into this presentation today. And Cory, whenever you're ready, go ahead and take it away.
Great, thank you. As always, I appreciate the invitation to be here today. It's always great to speak with like-minded people and always appreciate the opportunity. So as we talked about, today we're going to talk a little bit about the safety as a career field and some of the different things that we all collectively experience. So what I based this on was the fact that we all work around developing, safety leadership and safety management systems and how we can do that effectively, but at the same time, not burn ourselves out and watch out for these different potential challenges or pushback or these different situations that can cause a lot of distress and a lot of potential mental health issues, most of which I've seen myself, to be honest. So we'll talk about that as we go. And as always, if there's any questions or concerns, we're always happy to talk more. So like I said, we'll talk today about some of the things we've learned over the years from peer feedback. So one of the things I always try to do is speak with individuals that I work with, both in my organizations and organizations we partner with, and also with people from National Safety Council and from ASSP and all the different organizations, so that we can always learn what that feedback sounds like and what it looks like, and how we can improve not only with our technical knowledge, but also with our interpersonal skills and communication skills and all these different things that we need to develop that, transformation and servant leadership. So within that, we'll also talk about how we can increase our validity and reliability of our leadership. So how we can make sure that we know that our safety leadership is actually creating safe conditions and safe work practices, and it will continue to do so. So we want to watch out for those different flukes and lucky spells and different things that may be deceiving. And then we'll talk about how emotional intelligence and empathy plays into that, not only for ourselves in terms of our communications and our workings with our, employers and our teams and the general public for that matter, but also the things we want to watch out for on our own end, so that we don't end up with these different potential mental health issues or burnout or stress, or these things that can cause some difficulties. And then of course, we'll also talk about how that relates to job satisfaction and overall anxiety. So what we always like to do is tailor these conversations to a foundation, to a set of benchmarks, to a set of standards, things that we can look to, so that it'll provide guidance. So it's not just a matter of watch out for this, watch out for this, watch out for this. We can say, okay, this is what we're doing. This is the process we follow, and here's how it relates to that. So in this case, we're going to talk about risk management, and we're going to talk about safety management. So the first thing about this is, with our jobs, we're ultimately trying to compete with a number of other organizational values and priorities for resources, bandwidth, and attention. So what that means is that we want to be able to do this, to be able to relay the hazard, the risk level, the expectation for hazard control, what those options are, and then how to do that effectively without creating any kind of kickback or any kind of situation where we're being perceived as a nuisance or as a hindrance. So we want to be able to be added value, and we want to be able to be effective and efficient. So the first part of that is being able to relay the risk. And so we want to make sure the organization understands whether we're talking about a strategic risk that's going to affect long-term viability, or in some cases solvency, or whether we're talking about operational risk, which means the ability to be able to perform our operations and our functions, having the staffing, having the logistics, being able to watch out for those day-to-day hazards. And then of course, we have to look out for external risks, things we can't control, but we can mitigate. And then of course, hazard risk, which goes into the risk treatment process. So for each of those hazards, the organization needs to make a decision as far as whether it's risk acceptance, risk avoidance, risk transfer, or risk control. And so the first step of this is always getting on the same page as far as those expectations. Because if the organization is saying risk acceptance and we're not comfortable with that, then we need to be able to make a case for why risk control is needed. And we need to be able to either get on that same page or figure out where we're going to go from there. But if we had that gridlock and that standstill on that initial decision, then that can lead to some pretty uncomfortable situations. At least I've seen that in the past. So like we said, we want to be able to get on the same page there. So we want to all be in agreement as far as whether we're doing risk acceptance, risk avoidance, risk transfer, or risk control. And then likewise, if we're doing risk transfer, we want to make sure we know that if we're doing a contract, the organization that we're working with, the expectations for them. So we don't, we're going to transfer that risk, but then we bring in an organization that's, unsafe. So again, we want to make sure that we're all on the same page there and we're able to find common ground. Then the next step, of course, is that we want to be able to look out for how this relates to continual improvement and high reliability. So when we look at our safety management system, as you can see here on the bottom, we're talking about basically 6 major components. We have our hazard analysis, where we know the hazards and the risks. We know the hazard controls, which are the expectations for what we're going to do about those hazards. We have our communication as far as relaying the expectations and enforcing and reminding. Then we have the leading indicators, so we can validate that those expectations are being met through inspections and observations and near miss reports and perception surveys and all those different things. And then we have our lagging indicators to figure out if anything's gone wrong. And then we have our incident analyses. We have our fault trees and our FMEAs and 5 whys and all these different ways we can figure out what happened and how it happened and why it happened. But the important part is being able to relay how these things relate to that high reliability concept. So we want to be preoccupied with failure. That's how we look for the hazard. We look for the risks. We make sure we have the right controls. And so it's one of those things that if the organization isn't willing to implement those controls, then we need to be able to either articulate why those things are important, or we need to be able to find an alternative solution that everybody's comfortable with that mitigates the risk to the, to the acceptable level while working within the constraints of logistics and budget and personnel and all these different factors. And then, of course, we want to be able to communicate these things. And that also takes us into deference to expertise, where we want to make sure that we're bringing in the right people so we get the right subject matter expertise, but also we get the buy-in so the organization knows what's expected. They have everybody's involvement and engagement, and then we're able to develop the controls and communicate the expectations to where everybody knows what's happening and why. And then we want to do that in a way that's sensitive to operations. So what we mean by that is we want to make sure that when we're working on these things, again, we're providing added value so the organization knows that the controls are preventing incidents that's going to enable the operations, so that it mitigates that perception that we're a hindrance or we're standing in the way of operations. And then, of course, we want to make sure that we're also reluctant to simplify. So, for example, we may have an engineering control, but it may not cover the hazard to the extent it needs to. So we need to also implement an administrative control or PPE on top of that. And so again, we want to be able to communicate those things in a way that the organization understands why it's there. And then, of course, for those incidents that do happen, we want to make sure we can learn from that. So we're committed to resilience. So ultimately, like we said, the first step in that is that we're all on the same page so that we know what the hazards are, what the different risks are, what we're doing about the risks, whether we're going to control it, and making sure the controls are to the level that's effective. And then, of course, we want to make sure that we're communicating those expectations so everybody knows what's happening and why. So in that case, we're all on the same page. And then, of course, that goes into our safety management system, which is our continual improvement. So we have our continual safety committee or infrastructure. We continually assess the hazard controls, communicate the expectations, validate them through our leading indicators, monitor the lagging indicators so we know what went wrong, and then analyze those situations so that we're able to be resilient and learn from them. So once we're doing that, and here's another example of what that looks like, then that kind of gets us on the same page. So one of the biggest things that tends to cause a lot of friction and a lot of issues is that either there's not clear communication as far as the hazard and the severity of the hazard, the risk level, or there's not articulation as far as why those controls are needed. And so a lot of times the organization may misinterpret that, or the safety professional might feel like they're being put into a position where the situation is not at the level of safety that's desired, and then it's going to create that continual friction. So again, it's important to get on the same page. And then that takes us into how we're able to develop these things as far as leadership. So, of course, transformational leadership, we want to make sure that we're able to articulate what we're doing as far as safety leadership. So what the hazards are, what the risk levels are, and why those controls are needed. And then from there, we want to make sure that we're watching out for servant leadership. So we want to make sure that we're able to do these things that benefit our teams and benefit, the population that we're serving. So one of the things we always talk about with employers is that, we want to try to avoid those professional development embargoes. I've seen a lot of situations in the past where, sometimes organizations will be hesitant to engage with things like National Safety Council or ASSP or whatnot, because what they're afraid of is that there's going to be a legal situation or some kind of miscommunication or whatnot. But ultimately, if we're able to advocate for that, not only does it allow for continual professional development, but it allows for the intake of best practices, which is always a good thing. One thing I always say, we want to try to avoid what I call desert trade leadership, where if we have people that are on our teams, especially if we have direct reports, is that we want to make sure that we're not expecting people to continually work and continually create and then bring us these options. And then we just kind of we cherry pick the ones that we want. And then they end up with a lot of work that never gets used. But if we're able to set those expectations early and define what we're looking for, then that way all the production is done in a way that's effective and efficient. And that's always very important there as far as hazard controls, because in many cases we're working on a limited budget. We may not have the money, we may not have the availability of the product we need. That was a big deal in the last 2 years with N95 respirators, is that their data weren't there to be bought. So we want to make sure that we're able to clearly define what we're looking for, what we need, and then we're able to do that effectively, instead of looking for a whole bunch of options and then trying to cherry pick the best of them after there's been a lot of resources put into it. And the other thing is that, procurement is not necessarily progression. There's a lot of great tools out there these days, more each year. There's different electronic resources, there's online resources, there's all kinds of tech, and that's all great. But what we're going to do is make sure that we have a purpose for that. So for example, if we're going to improve our, let's say our leading indicator program, so we want to improve that through the use of technology, then we want to make sure that we already know we have the hazard controls. So for example, if let's say we're going to do an inspection to check for disease exposure prevention, we want to make sure that we already have all of the prerequisites there. So that's going to be your physical separation, your social distancing, your face mask or source control, your hand hygiene, your surface sanitation for those people that are within proximity to potentially infectious persons. You got your respirators and your PPE and your bio-waste disposal. So once we have all those things, then we're going to create the expectations, and then we can create the checklist so we can inspect and observe to make sure those expectations are being met. So, are people social distance? Are people wearing a mask? Are people wearing a respirator? Are we disposing of bio-waste properly? And then at that point, once we have the controls and we have the expectations, then if we choose to implement a new solution for the actual observations, such as a tablet with an online checklist or whatnot, then it simply reinforces that. It's just a new way to do the data collection in a more effective way. But if we have the tablet, we have the online resource, but we don't have the hazard control or the checklist, then it's not going to really improve anything. It's just going to be a shiny new toy. So again, we want to make sure that if we procure things, we're doing it for a purpose. It's going to improve and not just because it's cool. And then the next thing, of course, is that we want to, again, going back to the first couple of things we talked about, is we want to make sure that we're clearly communicating so that there's an understanding. Here's the hazard, here's the risk level, here's the expectations, and here's what that looks like in terms of safe practices and safe conditions. But we don't want it to be the kind of thing where, a couple of months pass and there's an incident and somebody says, well, we didn't know that we were supposed to do this. And then the question, okay, well, we did the training, we did the in-service for the hazard control, and they say, oh, well, you didn't use these specific words, so I didn't know it was important. Or someone will say, well, you didn't convince me that it was important. So again, we want to make sure that we're being very clear and very articulate with our communications so everybody knows the expectations. And then we always want to ask for feedback and ask for any kind of input so that there's a two-way communication and everybody's engaged in it. But if we find ourselves just talking blankly to a group and then later on something happens, there's always the chance that there'll be, someone will say, well, you didn't convince me, or you didn't use the right words. I didn't know the importance. But if we can avoid that situation, then it just removes that friction. Then the other couple of things on here are that, we want to watch out for situational and contingency leadership as well, because working in safety, we have situations where we're working on day-to-day improvements. We're working on monitoring our existing hazard controls. We're working on communication, and we're working on leading indicators. But then you also have situations that call for very distinct directive leadership, where you may be dealing with an incident command system construct, or an emergency situation or whatnot, or a incident analysis where something bad happened. And so in that case, with situational and contingency leadership, we want to be able to know when there's a shift and we need to go to anything like directive leadership, or again, contingency leadership, where we're going to be able to change the intention and define where, when it's a situation that has increased severity, increased urgency. So we want to make sure that we're able to communicate that. And then the other things there is that we want to watch out for when there's a difference between macro leadership, meaning that we're going to, give more autonomy and we're going to let people figure things out, and when we need to be more micro, where we need to define the expectations very clearly and then make sure they're being done. And that kind of gets us to a point of optimal leadership. So it kind of looks like this. So if you notice here on the top there, it kind of gives a little dashboard, so to speak. So you've got your optimal leadership in the middle, but what you'll find is, this is after kind of several years of observations and conversations and research. Over on the left side, if we have organizations or leaders that veer toward very hyper macro management, so they just really kind of let things go and let people figure things out, and they just kind of stand back and don't really say or do anything, then typically what happens in the employment population is that people either become very apathetic, where they're like, well, this organization doesn't care about my safety, so I don't care either. Or you get into power struggles where somebody on the team will decide that in the absence of safety leadership, they'll say, well, I'm going to be the safety leadership. And then it kind of turns into this kind of Lord of the Flies situation where people are fighting amongst themselves about who's in charge of safety, and it just doesn't really work. On the right side, though, you get a situation where it's the opposite. It's hyper micromanagement. So you get people are just on everybody, and it's this constant like dictatorial, very, very defined, very, very directive leadership. And so what we find there is that people tend to get scared, like they think they're going to get fired. And there also turns into resentment, where when people feel like they're going to be fired, they get anxious and they get upset, and ultimately they start looking for another job, or they have incidents because they're on edge. They're working on razor's edge. For example, I had a leader once earlier on in my life that told me straight up that his idea of leadership was every month he called all of his team members, all of his direct reports into the office and threatened to fire them, because he thought that keeps them on edge, keeps them productive. And in reality, it just makes them scared and upset. And so you see on the bottom here, it kind of breaks that down even more. So what we've seen is that on the left side, when you have that macro management, you have the very kind of apathetic, hands-off, little communication, no expectations. Then, on one end of that spectrum, you get people that are, just kind of, well, whatever, apathetic, a lot of inactivity, definitely nobody's looking for hazards, nobody's putting controls in place, nobody's communicating, nobody's doing leading indicators. And then on the other side, you get that kind of Lord of the Flies thing where people will fight amongst themselves about who's in charge in the absence of actual leadership. But in actuality, with nobody having any actual role, then it just turns into this kind of unfortunate situation. You see there on the other side, when you have that micromanagement, we get the opposite there, where on one end, people are scared and they're kind of on razor's edge, working, trying not to get fired. But then on the right side, you get that resentment where they say, wow, these people are just always on my back. I'm upset. I just want a different job. So either way, people are either not productive, they're in danger of being injured or exposed or ill, or they're going to find a new job and you don't have any continuity or any sustainability. So within that, the first thing to look for, of course, is the way the organization's set up. So if we're looking for management, there's a big difference there between the horizontal structure, where you have your different departments, and then you've also got your vertical structure, where you've got your different organizations. So for example, if you're talking about a healthcare system, you may have your vertical structure where you've got different hospitals. So you've got hospital 1, hospital 2, hospital 3, hospital 4. And then on your horizontal, or excuse me, your vertical, on your horizontal, sorry, I got that mixed up. On your horizontal, you've got your different departments. So in your hospital, then you've got your ICU and your emergency department and your radiology and your clinical units, et cetera. So within each hospital, you got the different departments. So you got your horizontal structure and you got your vertical structure. When that becomes challenging is when you have different leadership. So you've got one set of leadership directing the hospital itself. That's your executives and your management. And then you've got your individual department leadership who's developing the objectives for the individual departments, like what happens in the ICU, what happens in the ED, what happens in the radiology department. If neither of them take on safety, so the hospital's not talking about safety and the department's not talking about safety, then it's absolutely true that the employee is not going to hear about safety. They're not going to hear about the hazards. They're not going to hear about the controls. They're not going to hear about the communication or the leading indicators for that matter. So what we want to do there is either number one is define, okay, well, is safety going to be handled at the macro level by the organization, by the hospital, and by the system, or is it going to be handled by the department, or both? And so if it's going to be that way, then we want to make sure it's reinforced. So the hospital or the organization sets the expectations, and then the department knows those expectations and they can reinforce them. And that way, when it gets to that particular department in that particular hospital, they know exactly what the hazards are, what the expectations are, and they hear about it, they know about it, and they can validate that it's being done in real time. And so when we have that mixed management structure, when you have both vertical and horizontal, sometimes it becomes challenging because neither one of them will be talking about safety and it just gets overlooked. And so if we watch out for that management structure, that can tend to help with the situation. So once we have that, so now at this point, we have our communication, we know the hazards, we know the risks, we know we're putting the proper controls in place, we've articulated why that's important. So we're reducing a lot of the friction, we're increasing communication, we're working on professional development so we can get best practices. We are, we're being clear with expectations, so we're not creating a bunch of lost work and lost time. And of course, now we're able to do this so that we can increase safe work practices and safe work conditions. And so what I say on here is we want to do this regardless of buzzwords. There's a lot of chatter that we always see in the safety community where people will talk about, oh, well, it's behavior-based safety, or it's regulatory issues, or it's employee-based safety, or it's any number of these different things. But the reality is that regardless of what we're calling it, we're looking for safe work practices, which is how we do our tasks inside of safe work conditions, which is the safe facilities, the safe equipment, and all the different emergency management, weather protocols, all those different factors. So if we do that, then what that enables is that we're able to help other people. And at the same time, we're able to take care of ourselves, because especially like in a healthcare organization, if we have situations that are unsafe for the employee, then by definition, it's also going to be unsafe for the patient or for the bystanders. And so we want to make sure that we're able to do this. So to make that happen, we get into dual accountability. And so of course, with dual accountability, we want to avoid those situations where people will say, oh, well, behavior-based safety is just trying to, blame the employee. Or if we have the opposite where they say, well, it's regulatory and everybody's just waiting around for, OSHA to come by or for the management to talk about it. what we want to do is dual accountability. So like we said there, the employer or the leadership or the safety leader for that matter, then we're going to be able to do the safety analysis, know the hazards, define the risk level, put the controls in place. And then we're going to do that with engagement and with communication and with feedback from our team members. And then once we develop those hazard controls and expectations, then from there, now the leadership has the responsibility to continue to monitor that and continue to improve based on the safety management and the high reliability principles. And the employee has the responsibility to stay engaged and to follow those safe work practices and watch for the safe conditions and to report the situations and the incidents. And then we can continue to improve as a whole. But if one side is waiting for the other one, then ultimately we're going to miss something. And so that gets us into the work itself. So now we've talked about the management, we talked about the safety management systems, we talked about the leadership and the management setup, we talked about communication. So now with the individual, employees and the individual work, then we want to make sure that we understand, there's a big difference between being responsible for safety and having the authority to make direct changes. So what we want to do is know where we stand, so for example, if we don't have the authority to purchase PPE, then we want to know who does, and we want to be involved in those conversations, and we want to get those people on the safety committee, and we want to be able to explain why those things are important and how to make that happen. So it's not the kind of thing where we're just talking about why it should be that way and we're being interpreted as complaining, but people don't really understand what the situation is. And so, of course, we want to do that proactively. So we want to be able to analyze the hazards, identify the needs, and make those recommendations and take the appropriate actions before there's incidents. And then from there, we want to be able to resonate that with everybody. So for example, we want to know our audience. If we're talking to team members, it's probably not going to resonate with them if we stand in front of them and talk about the cost to the organization. If we say, well, the incidents for the last month cost the organization, whatever, $200,000. They're going to go, well, okay, I'm not involved with the budget. I'm just worried about not getting hurt. But if you talk to the senior management, then we want them to understand that these incidents, they're affecting individual employees, people's safety and health. They're affecting people's livelihoods. They're affecting the organization's viability. They're affecting operations. They're affecting the bottom line. So we want to be able to know the audience and be able to explain these things in a way that's going to resonate. And so we want to do that in a way that's not any assumptions, any arrogance or condescension. So what I mean by that is when we're safety professionals, we get very accustomed to talking about safety. And so if we talk about a regulation, like for example, let's say respiratory protection, which is 1910.134, it's very easy for me to get into that and I'll go, well, 29 CFR 1910.134 says that we have to have hazard analysis and medical questionnaires and training and fit testing. And I can get into that in 2 minutes will pass and people are looking at me wondering what I'm talking about. So if I go into those conversations, assuming that everybody's at that same level, or worse, if I condescend about it, I'm like, well, you don't know this? What's wrong with you? The fact is they never had that training. It wasn't part of their professional upbringing. So we want to make sure that we don't go in there assuming things and condescending about it. And then from there, when we're doing this, one of the things I've seen in the past that was kind of danger area is that some organizations, for legal reasons, if they're working on quality improvement or if they're working on some different situations involving quality or whatnot, they'll have these legal disclaimers. So what that means is that because this is, internal information, we're working on quality improvement, then it's not discoverable. And sometimes they'll get mistaken and they'll think that you can put that quote unquote quality statement, the disclaimer, onto an incident report and that somehow, OSHA can't see it. But that's, as we all know, that's not how it works with OSHA record keeping, and it's not how it works with OSHA 300 logs and things of that nature. So it's important that we're able to articulate that as far as a precedent, so the organization understands the boundaries as far as legal disclaimers and quality improvement versus incident reporting and OSHA record keeping. So once we have those precedents, now we're talking to people, now we're starting to work on these things. Then again, we want to explain how this works holistically, because sometimes organizations will assume that the safety professional or the occupational health nurse or the risk manager is going to just handle all this, and they don't have to think about it. I had somebody tell me once, well, if I have to think about this, then why'd I hire you? But the reality is that safety culture is just not going to proliferate unless we have everybody involved. So this kind of shows how that works. So you see in the middle there, we're aiming for safe work practices or safe behaviors within safe conditions. And so to do that, we have our safety management system. So we have our committees, we have our hazard analysis, hazard controls, communication, leading indicators. And then to make that happen, everybody needs to be engaged, follow the safe work practices. So follow the SOPs, use the PPE, etc. Everybody needs to participate as far as communication and engagement and sharing best practices, sharing stories, sharing recommendations. And then everybody needs to communicate these things. So to make that happen, then the leadership needs to set the example, set the expectations, provide recognition, especially when people are doing a great job, and due diligence. They got to provide the PPE and provide the processes and provide the oversight, all the things that are needed. And then lastly, you got your occupational health and safety, where that way we're going to be able to provide the consultation, the assistance, the support, and the oversight to make all these things happen. So if everybody works together, then we're able to make those safe work practices and safe conditions a reality. And then within that, like we talked about before, is those things allow for transparency and allow for servant leadership and professional development and horizontal and vertical management structures and all the things that are needed to make that a reality. So then, of course, with our safety committee, once again, we want to make sure that we're able to articulate why the safety committee is so important. So it's not just something that takes an hour out of each month. It's important that it's able to provide that engagement and that subject matter expertise and that advice and consult, so that over here you have in your big triangle here in the middle, you have your leadership structure, you have your employees, you have your department leadership, and you have your organizational leadership, and you have your line authority, and you have your performance improvement plans and everything that happens there. And that's where your dual accountability is needed. The organization's got to provide the hazard analysis, the hazard controls, the expectation. The employees had to provide feedback and input and meet the expectations and follow the safe work practices. And then over here off to the side, you have your safety committee, where that's where you get your subject matter experts together. You determine where the hazards are, what needs to be done about it, and make those recommendations so they can implement that into the operations. But it's also important that everybody understands that the safety committee isn't line authority. So if there's a performance issue, like if somebody's not following the safe work practices, the safety committee may be able to identify when those things are happening, but it's not their job to write the performance improvement plan. That's where it goes over to your line authority. So again, knowing the difference is very important there. Then once we start doing the hazard analysis, then, first things first is we want to use that as an engagement opportunity. So we want to make sure that we're getting the feedback and the input so people can tell us when there's safety issues. And then we want to have the due diligence, so we follow through on these things. So when we identify the hazards, then we want to explain what we're being done about it. And then from there, like we said, with the risk assessment, we want to be able to articulate the frequency and severity. And we want to make sure that we're being objective about it. Some of the things that can get tricky is when it becomes subjective. So for example, with the pandemic in the last 2 years, there have been a lot of situations, worldwide, where people have said, well, in my opinion, I don't think that this thing is a high risk. And so therefore, we're not going to do whatever it is, face masks or distancing or respirators or whatever's needed. And without there wasn't an OSHA regulation up until the ETS came out a couple months ago. And so it became very subjective. So again, we want to watch out for objectivity there so that we're able to clearly define what the hazards are, what the risks are without any personal bias. And the bias may come from, relativity, meaning I haven't seen that hazard right in front of me, but that doesn't mean it doesn't exist. Or it may be personal experience where they say, well, I tripped and fell last week and I didn't get hurt, but in reality, somebody may trip and fall tomorrow and break a bone. So we want to make sure that we're able to be objective about the hazards and the risks without getting tripped up on our own personal perceptions. And then the transparency is that we're able to articulate those things very clearly based on frequency, severity, objective perspectives. And then from there, we can put those controls in place. So this is where we're going to actually define what needs to be done to prevent the incidents. So we want to be diligent about it. We want to make sure we have the expectations and the procedures and the PPE and the lockout procedures and all the things that are needed. We want to make sure they're effective. So they're actually gonna do what they need to do to mitigate the hazard. We want to look for redundancy. So what I mean by that is, for example, using the pandemic as an example, there's some organizations that said, well, we're going to check temperatures at the front door, and then we're going to ask everybody to stay 6 feet apart. But in reality, that just checking temperatures, somebody can get past that just by taking Tylenol. And if you don't have social distancing set up as part of your processes, then it may not happen. But if you add in, for example, if you add in the face mask for source control, then that contains the droplets. If you physically separate people, then that way their workstations aren't near each other. If you have people that are in proximity to potentially infectious people, then you have your respirators, which provides the PPE and the air filtration. So redundancy is important, that we're able to capture all the different ways the hazard can exist. With slip, trips, and falls, for example, it may be the kind of thing that, it's one thing to put down a wet floor sign, but it's much better to clean up the hazard and draw the floor. Or if we have cords, we can tape the cord down, but if it's possible, we can move the cord, or we can get it tied up so that it's out of the way. But we want to make sure we don't settle for the easy option. Then of course, we want to make sure we're looking for feasibility. So sometimes, for example, again, with the pandemic, it wasn't feasible to get the same model N95 that we've had for years, because they weren't available to be purchased. So instead we were able to find new N95s, but then we had to make sure we went back and got the new fit test with it. So that way we found the feasible option, but we still made sure it was safe. And then of course, applicability, is we want to make sure that the hazard controls that we're using apply to that actual hazard. So one of the things that's important there, for example, with workplace violence, there's been some situations where people will say, well, we're going to do a risk assessment. So if there's any reason to believe that somebody is potentially violent, then we're going to run a background check, and we're going to run a police record. And then if that person seems to be dangerous, then we're going to just remove them from the situation. But in reality, a lot of these workplace violence incidents happen before there's ever any indicators. So having that process is great for long-term strategy, but we also want to be able to provide education and training on the indicators to look for, as far as the potential aggression, or any threats, or body language, those different things, then how to de-escalate that, how to create reactionary distance, how to hit a panic button, how to call for support. So all these things that can create safety in real time. So again, it provides to where it's applicable to the situation, it's feasible, and it provides the redundancy and the due diligence. Then of course, the situational awareness is important, because if people don't know what to look for in real time, then there's a pretty good chance the hazard can get overlooked. And so of course, these things apply very importantly, because when we talk about hazard controls, in some cases, we can eliminate or we can substitute certain chemicals or whatnot, or we can use engineering control. That's a great way to do it in a scientific way. It creates passive controls. And so people are able to work safely without having to really do a lot of critical thinking. But when we get into mostly some administrative control, or excuse me, some engineering controls, a lot of administrative controls, and definitely PPE and training, then it becomes an art form. It becomes leadership, because we have to be able to train people to do these things in real time. And so, of course, art form is the most, leadership is the most difficult art form. So we want to be able, again, to go back to the clear, transparent expectations. And so, like we said, with communication is we want to be able to be consistent, and we want to do that without being to the point where people consider it annoying. So the best bet there is to use different formats, consistent, recurring, different methods. So it might be something as simple as emails, tailgates, or safety moments, different discussions, bulletin boards, websites, newsletters, all the different ways we can communicate. But the idea is that people hear it on a consistent, recurring basis. And then, of course, we want to watch out that sometimes I've seen things in the past where organizations will feel like if we talk about safety, then it creates a liability, because if there's an incident, someone can say that we talked about safety, but then this thing didn't happen, so we didn't follow our own policy. So it becomes a liability. So once again, we want to be able to talk to the organizations and everybody be on the same page as far as what the expectations are and how the hazard controls work, so that we're able to clearly define those safety needs and communicate them without any fears of that. Then we get into our leading indicators. So we want to make sure that we're able to, to prevent as much as possible. So you can see this guy here. He's this guy on the top. He's getting perplexed because he's chasing these incidents, can't figure out why they're happening, and he's got his incident reports and he's losing money and chasing this thing that's already happened down the hill. But this guy down here, he's got his near miss reports and his inspections and observations, so he's able to prevent those things. He's going to stop that incident before it rolls over him. And so again, that's very important that we're able to do that. But we want to make sure that we're following through on it. So we want to make sure that if we do an observation, we find something that's potentially unsafe, that we're able to follow through and figure out whether we need other hazard controls, or whether we need to communicate better, or whether we need retraining. And we want to do that without being counterproductive. So we don't want it to be a gotcha game, or where people get scared and they think they're going to get fired. We want to make sure that it's a just culture. And a lot of times incentive programs can help with that, or recognition. So if we do the observations, when we see safe work practices, if we recognize that, then people are empowered and they take the initiative to work safely, because they know that it's not something they're going to get any kind of reprisal for. And we, of course, want to watch out for these things, because with lagging indicators, unfortunately, they just go from bad to worse, where we have a situation that, first it affects the employee, then it affects the incident rate, but ultimately, and more importantly, it affects people's health. We get situations where people are on days away, restrictions, or transition on duty. They can't work, they get incurred costs or direct costs. And then from there, it affects compliance, it affects productivity, but more importantly, it affects people. You have less people to do more work, which creates rushing, fatigue, frustration, distractions, which creates more incidents. And then when we do those analyses, we want to make sure that we're able to do that in a way that's valid and reliable. So we want to be able to look at the situation and figure out what happened, why it happened, and what's needed to prevent it from reoccurring. But we don't want to do that in a way where people feel like, it's a village tribunal. So we don't want people to get called in and get put under a light, and they feel like that, it's not the kind of thing where people are looking out for their best interests or others. So again, we want to focus on what happened, why it happened, and how we can prevent it, and not make it an accusatory thing. And then that goes into just culture, is we want to make sure that we're able to continually improve without being a game of gotcha or anything that people feel is retaliatory. And so why this is all important is because what we talked about is this gives us a way to set up our safety management and our safety leadership to where it's beneficial for the organization, and it creates effectiveness and efficiency and holistic, positive safety. But it does that in a way that keeps it where we know what the expectations are, we know what we need to do, and we know how to do it well, and it works out with us and the team. And that in turn prevents us from having distress and burnout and fatigue. So if we know what we're working on, we know how it relates to safety committee, hazard analysis, hazard control, communication, leading indicator, lagging indicator, then that helps us with ultimately our mental health. So why that's so important is because first and foremost, we want to have emotional intelligence. So we got to watch out for this because ultimately it comes down to ethics. We want to make sure we're keeping things as safe as we can. And we want to do that without people feeling they're getting walked over. So you see here that with safety performance, there's a difference between not having a control or not communicating the control or not training people versus somebody didn't follow the expectation. But first, we got to make sure that we have the control, we have the training, we have the expectation, we have the communication. And then if they still don't do it, then it becomes a performance issue. And that's different than there not being an expectation and somebody getting hurt. Because we can't kill our way to victory. We can't fire people and write people up and expect them to suddenly become safe. And then again, it goes back to dual accountability. So another thing that we want to watch out for, both on our end and also at the organizational side, is gaslighting. And this is something, honestly, I didn't know there's a word for until a couple of years ago. I've seen this numerous times, more than I'd ever like to count. And I didn't know there was a word for it. But the reality is, you see here that gaslighting comes in several forms. In the past, I would have just called it people being unethical, people being selfish, people being mean. But what it is when someone tries to assert power over somebody else, and they do that by telling them bold-faced lies, or by denying something, or trying to coerce somebody, or they're doing things that they're talking about things they don't actually do. They try to confuse people. And so with safety, this becomes very relevant because number one, as safety professionals, we want to watch out for these things. I've seen all these things in the past where people will tell me things like, oh, well, you didn't do this, or you didn't train this person, or you didn't write this plan, or whatever it may be. But in reality, every time I was able to come back and show the evidence that had been done. And so when somebody is making accusations or things of that nature, it can get very stressful and it can be hard. So if we know what gaslighting looks like, then we can watch out for these things on our own end. But as far as being safety professionals, we never want to do these things. So for example, if we have a situation where something's potentially unsafe, we don't want to be the person telling people, oh, you're just being paranoid, just go ahead and do it, don't worry about it, or oh, I know you think it's a high risk, but I know better, don't worry about it. We want to make sure that we hear their feedback, we hear their concerns, and then we're able to work on behalf of everybody, which is servant leadership. So we don't want to be the one doing these things. And so the way that, again, we can watch out for these things and definitely not be the one that does them. So the way to make sure that we can kind of safeguard against this for our own safety, for our own careers, so to speak, is that, like we talked about before, we want to do our diligence. So we want to know that we've done our hazard analysis. We know the hazards, we know the risk level. We communicated the needs. We communicated the expectations. We communicated the hazard controls. We did our leading indicators. We know what observations. We know our inspections. We investigated and analyzed the incidents. Because if we've done these things and we can vouch for these things, then it's much more difficult for somebody to gaslight us. And then of course, as far as our teams, we want to make sure that we're very clear and transparent. We want to be able to set the expectations, define the hazard controls, and then validate those things are being done so that people don't feel like they're being told to do something that's unsafe. And that in turn creates that just culture so that at the end of the day, we have 25% of our people that are already working safely. If we have 25% that are going to be defiant about it, and then we have 50% in the middle, we want to work to actively get those 50% in the middle to work safely. So the more people we have that are working safely, the people that are defiant feel more uncomfortable about that. And ultimately, this creates a situation where we're able to prevent as much as possible at the high frequency level so that it doesn't become more severe. So as you see here, it goes backwards. We have the visitor safety issues that are more severe but less frequent. We have infection control issues that are less frequent, but again, more severe. And then it gets up to that emergency management level where it's the most severe. And when I say most severe, not only for in terms of people's safety and health, but severity, it'll shut down the organization. We saw in the last 2 years, the pandemic completely shut down the economy. So if we handle these hazards at the employee safety level, then we can prevent it from becoming a public safety, infection control, and definitely not an emergency management situation. And that in turn allows us to be able to, to mitigate those stressors and create an environment where not only are we able to efficiently and effectively work, but the organization benefits and definitely the team and the public benefits. So this is kind of a case study that I always show where we can see how these things happen. So once again, if we're able to trace all of our efforts back to those consistent components, hazard analysis, hazard control, communication, leading indicator, lagging indicator, investigation, and we're able to do those things effectively, efficiently with transparency, good management, servant leadership, then that's going to in turn help us do our job without those extra stressors and extra burnout. And then in turn, that also lets us watch out for anything so we can make sure we're not gaslighting and we're not being gaslighted, and that we're able to continually improve, not only for others, but also for our own safety. And so the last thing we always want to talk about is that we want to watch out for any whistleblower situations. So we want to know about what constitutes a whistleblower and why that's important. We've had situations in the past with Ebola where whistleblowers were very prevalent. There have been situations with COVID-19 where whistleblowers are very prevalent. And we got to watch out for that because it can also lead to normalization of deviance, where if we don't catch these things, then they can become normal, and that creates a much higher risk. And ultimately, if we watch out for these things, then it creates sustainability for everybody involved. So we have good mental health. We can watch out for things like PTSD, whether it's from incidents that happen at work or whether it's things in our own life. And we can watch out for our own physical health. So if we're able to, streamline our efforts, keep things effective and efficient, then that makes everything better all around. And then of course, we also want to watch out for those things in terms of possible situations with HIPAA. We want to make sure we're having good confidentiality, good privacy with the information we share. And we want to watch out for Disabilities Act. When we're putting those controls in place, is that we want to make sure that those are effective for everybody and that there's full inclusion there. And some things we also want to think about are that, of course, the work is, it's never going to be complete. It's just the way it goes. There's always going to be something to prevent. And that constant proactivity can in turn create anxiety. But if we watch out for that and we make sure that we have the hazards watched out for, the controls in place, the expectations, the communication, and the validity, then that way we know that we're doing our diligence and we're able to continually improve. And ultimately, it comes down to these 5 things. So if we do those things consistently and effectively, and we watch out for those potential issues we talked about, then ultimately we can always get better and salvage our own mental and physical health in the process. But as always, of course, this is the kind of thing we could talk about forever, but if there's any questions or concerns, I'm happy to talk more offline, and appreciate y'all's time today.
Well, thank you, Cory. Really appreciate you sharing your insights with us today. Before we start the Q&A, I want to let everyone know about an evaluation survey that we're asking you to complete. The survey will open up in a different screen after this webinar, and your input is really important to us because it does help us to improve our future webcasts. Cory, it looks like we've got time for one question today, and I wanted to take a question from our audience here. And our audience member says, I'm a safety director and I have a large say when employees are terminated for safety issues. Now, his wife is concerned about potential workplace violence issues. And our audience members wants to know, what can he do to protect himself and also maybe ease his wife's fears a little bit about workplace violence situations as a safety professional?
That's a great question. And there's a couple of variables in that. So the first one is, like we talked about, we want to make sure that we have a just culture. So we want to make sure that we're very clear about the hazard, the risk, the expectations as far as safe work, and that we're able to validate those things. So if something's unsafe, we can do corrective action and we can make sure that the employees are taken care of. And then if it becomes a performance issue and we have to go into whatever the word I'm looking for, accountability, enforcement, so to speak, then we want to make sure we're very transparent about that. And then from there, if it still leads to that situation, then we want to make sure that we're being sensitive to things like HIPAA. So if the employee has any personal health conditions, ADA, if they need any accommodations, anything we can do to make the situation better and prevent any kind of anything that's potentially unethical, unjust, anything that may aggravate the situation. And then, of course, we always want to check to make sure that, we're doing things by legal means. If there's any situations with whistleblowers or any other factors in there, we want to watch out for that. But if there's still a situation where somebody's needs to be terminated, then we would definitely want to watch out for any indicators there. So again, we want to make sure that we covered all of our bases. And then as the situation goes through, we want to watch out for anything such as aggression, threats, any hostile intimidation, anything that may give any indicators there's potential workplace violence. If there's time and resources, things like background checks and whatnot can always provide some kind of insight if there's time for that. And then from there, there's certain measures, they can have security, deterrence in place. Things like panic buttons can help. And then, of course, just knowing when it's time to call for support and when it's time to egress. But outside of the workplace, definitely, watch for indicators, see if there's any reason to believe there's a threat. And if so, call for support. If there's any emotional needs there, then the employee assistance program is a good thing. There's always people to talk to, support that can be gotten. And, we can always watch for those things, because not only is it a potential physical threat, but there's also the potential for, anxiety, depression, burnout, all kinds of things that can come from that. So we always want to know we've done our due diligence, know we covered all of our bases, watch for indicators, call for support when needed. And a lot of times that covers a lot of the situations. And then anything that seems out of the ordinary, it's always good to report it and ask for help.
Great. Well, thank you, Cory. Appreciate that response. Unfortunately, folks, we have run out of time today. I'm sorry that we didn't get to everyone's questions, but all the unanswered questions will be forwarded today to Cory. Again, we also hope you take some time to fill out the feedback via our survey. And I'd like to thank our terrific presenter today, Cory Worden, everyone from our sponsor at Avetta, and of course, all of you who joined us today. This ends today's Safety and Health Magazine webcast. Take care, everyone, and have a safe day.